Are you turning 65 soon and still working, or are you covered under your spouse's insurance? Are you wondering if you should delay Medicare? Well, you're not alone. Thousands of Americans ask that question every day. And today we'll break down comparing employer-sponsored group health insurance plans versus Medicare and help you make the best decision for your health and for your wallet. So welcome to iHealthBrokers channel, where we talk about all things health insurance, specifically Medicare. So let's dive in. When you turn 65, you'll become eligible for Medicare, which is a federally run health insurance program. Now, if you're already receiving Social Security benefits, then you'll likely be automatically enrolled in Part A, which is your hospital insurance, and Part B, which is your medical insurance. Together, Part A and Part B make up Original Medicare. But what if you are still working, or your spouse is? Do you have to take Original Medicare? Well, the short answer is no. But there are some pitfalls that you should be aware of. Now, a quick refresher as to the different parts of Medicare, because there are many parts. So Medicare Part A is your hospital insurance. It's going to cover things like inpatient care, durable medical equipment, home health care, hospice care, and skilled nursing facility care. Usually, there's no premium for Medicare Part A. Then there's Medicare Part B. This is your medical insurance. Basically, anytime you see a doctor, Part B will be billed. It'll also cover things like diagnostics and imaging, things like x-rays, MRIs, etc., lab work, that type of thing. And there is always going to be a premium for Part B. Then there's Part D, which are your prescription drug plans, because Original Medicare really doesn't cover most prescription drugs, except for some very limited exceptions covered under Part B. There are some vaccinations and things like chemotherapy or certain oral anti-cancer medications. And then there's Medicare Advantage, also known as Medicare Part C, which is an alternative to Original Medicare. It's going to encapsulate all of the benefits offered by Part A and Part B. Very often it will offer prescription drug coverage as well, and throw in some additional benefits to entice beneficiaries. And of course, there's Medigap, which works in conjunction with Original Medicare. It's just going to fill in those financial gaps of Original Medicare to help you cover those out-of-pocket costs. For the purposes of today's video, we're really going to be focusing mostly on Part B, although we will discuss Part A as well. I also want to talk about that Part D late enrollment penalty and how deferring Original Medicare can affect your Medigap enrollment. Now, you absolutely can defer Original Medicare, and you may choose to, especially if you or your spouse are still working and maintaining creditable coverage through your employer's group health insurance plan. And if you are maintaining that creditable coverage, then you can avoid those late penalties, which we'll discuss momentarily. Now, if you're enrolled in a marketplace plan, things can get a little bit tricky, so please make sure to speak with your broker before deciding to defer Part B. And remember, short-term medical plans do not count as creditable coverage. Now, a pro tip, many people do decide to enroll in Part A even if they're going to defer Part B, because usually there's no premium for Part A and it can act as a secondary insurance. But if you're contributing to an HSA, you definitely don't want to go this route, and we're going to go more in depth later in the video. So if you are continuing to work past the age of 65, really you need to do a thorough comparison between your current health insurance plan and Medicare to determine which is right for you. So first, an easy cost to compare is your monthly premium. How much does it cost for your employer-sponsored group health insurance plan versus Medicare? As I mentioned, usually there's no cost for Part A. However, there's always going to be a charge for Part B, and in 2025, that base beneficiary premium is $185, but it can be more if you're a higher earner. And then you need to take into consideration the costs for a Part D plan if you're going to go that route, and of course, Medigap, which we highly encourage. You'll also want to factor in how this could affect premiums for anyone else enrolled on your plan. Then there are deductibles. You'll often find that deductibles with group health insurance are going to be higher than with Medicare. For example, with Medicare Part B, that deductible is a once annual $240. And then there's that Part A deductible of $1,676 applied per benefit period. But usually this works out in Medicare's favor. Speaking of things that work out in Medicare's favor, let's talk about networks. So if you have insurance through your employer, you have some type of network, whether it's an HMO or a PPO. A PPO will of course give you more flexibility, but nothing's going to give you as much flexibility as Medicare. There are no networks, and almost all doctors accept Original Medicare. As far as the coverage and actual benefits, that you're going to need to do a thorough analysis, because it might work out in favor of your current plan or Medicare might come out the winner. And then there is the out-of-pocket maximum. Now, your plan will have some type of out-of-pocket maximum. Unfortunately, Original Medicare does not have an out-of-pocket maximum, and it's possibly one of the biggest drawbacks of Original Medicare because although copays and coinsurance are going to be managed, if you have major medical needs, you could have major medical bills, and without that out-of-pocket maximum to protect you, you're really leaving yourself open to financial hardship. That's another reason many people opt for a Medicare supplement plan. Some employer plans are extremely generous. Others, less so. So you're really going to need to be thorough when comparing and contrasting to determine whether your current plan is better or whether it would be a better deal to opt into Medicare now rather than later. Let's go over a few examples. First, we have Tom. Tom is 66 and still working, but he's got really great employer insurance. Now, because he's still working and his employer insurance is very generous, it would be highly advised to defer Medicare Part B and of course Part D as well, and maintain his current insurance through his employer. This will help him save money on some of those premiums and other Medicare costs. Then there is Maria, who is 65 and she's still working, but she has a high deductible plan with less than generous benefits. And her health needs are slightly more extensive. Now, because she has higher health needs and is in a high deductible health plan, it would definitely be advised for Maria to go ahead and make the switch over to Medicare to save money, especially on that deductible. She should also go ahead and enroll in some type of Part D plan and probably a Medicare supplement plan at this time as well. Then there's David. He is self-employed at 65 and still working. But because he's self-employed, he has no group health insurance, so there's really no choice to be made here. He absolutely needs to enroll in Medicare to avoid some of those late penalties later down the line. Because remember, if you don't have creditable coverage and you don't maintain that creditable coverage, you will be charged a late penalty. And this is not a one-time penalty. It gets tacked onto your monthly premium forever. Now, a really brief pause here. If you have any questions about your Medicare coverage, you can absolutely reach us in the comments below or at the number on the screen. We're licensed health insurance brokers and we're licensed nationwide. There's also absolutely no charge for our services. We do release these videos on a weekly basis, so please make sure to subscribe to stay up to date. There are probably some changes coming down the pipeline to Medicare and you want to stay on top of it. And of course, make sure to like this video so we can get this information out there. All right, let's get back to it. So if you do decide to defer Original Medicare in favor of your current insurance, when you retire and your coverage ends, you'll enter into a special enrollment period. At this point, you have 8 months to enroll in Original Medicare or some type of part of Medicare. However, we advise that you go ahead and enroll within those first 2 months. And that's because there are different late enrollment penalties. Specifically, there is the Part B late enrollment penalty and the Part D late enrollment penalty. The Part B late enrollment penalty is much more significant than the Part D late enrollment penalty, but you should be aware of both. Basically, the Part B late enrollment penalty is 10% tacked onto your monthly premium for each full 12-month period that you are without Medicare Part B when you were eligible and you could have signed up, but you didn't. So actually, if you go 11 months without Part B, you wouldn't be subject to the late enrollment penalty. But once you hit that 12 months, you're gonna hit 10%. Once you hit 24 months, it would be 20%, and so on and so forth. For Part D, it is 1% for each month after 63 days. That's why we encourage you to go ahead and sign up within 2 months. That way you can avoid that Part D late enrollment penalty as well. Now for Part D, because it's only 1% and because those Part D plans can already be so darn inexpensive, this could just be a couple of dollars added to your monthly premium, but it's a couple of dollars that you don't need to pay if you stay on top of things. Additionally, in many states, there are Part D plans that actually have $0 in monthly premiums. They're plans that don't charge you on a monthly basis. So why wouldn't you go ahead and sign up for at least something to avoid that Part D late enrollment penalty? Now, if you miss this window, there are, of course, times during the year where you can sign up for the various parts of Medicare. If you were signing up for Medicare Part D or a Medicare Advantage plan, then that would be during the AEP, which is from October 15th to December 7th. If you're signing up for Original Medicare and you've missed your special enrollment period, then it would be from January 1st to March 31st. Coincidentally, during this time, if you have a Medicare Advantage plan, but you want to switch to another Medicare Advantage plan or switch back to Original Medicare, you can do so at that time as well. Now, if you'll notice, I didn't talk about any specific enrollment period for Medigap plans, and we are going to talk about that later in the video because this is so incredibly important. But let's switch gears and talk about dependents, because if you have dependents or a spouse that relies on you for health insurance, this can further complicate matters. So if you're trying to make the decision between deferring Medicare in favor of your current insurance or making the switch now to original Medicare, there are things that you need to take into consideration if you have a spouse or dependents who rely upon you for their health insurance. So first, let's talk about COBRA. So if you make the switch to Medicare, your spouse and your dependents can actually keep their current coverage under COBRA for a period of up to 36 months. However, you can expect that this is going to be pretty darn expensive. Those monthly premiums will at least double, possibly more. So this is usually best as a short-term solution unless you are somebody that is currently undergoing care and it's absolutely imperative that you keep the exact same health insurance. Or if you've already met your deductible or your out-of-pocket maximum for the year, it might be offset by those higher monthly premiums if you're going to have basically no medical spending for the rest of the year because you've already met your out-of-pocket maximum. Another option for short-term needs would be short-term medical plans. This is of course dependent upon where you live and what your medical needs might be because these are restricted to a shorter period of time. But if you have a spouse who is soon to be eligible for Medicare, this could certainly help to bridge the gap. And of course, there are marketplace plans. So when you switch to Medicare, this would make your spouse and your dependents who are currently enrolled in your health insurance plan eligible for a special enrollment period through a marketplace plan, so they can go ahead and sign up at that point. Earlier in the video, we also touched upon HSAs. So let's discuss those a little bit more in depth. Many employers offer HSAs as some type of incentive to enroll in their HDHP, which is a high deductible health plan. And these HSAs do offer an amazing tax advantage. And often people with HSAs are very unhappy about the notion of giving up that tax advantage. So please remember, if you choose to enroll in Medicare, you can no longer actively contribute to your HSA. Of course, you're not going to lose the money. It even converts to a basic retirement account at this point to be used as you see fit, but you won't be able to actively contribute and therefore take advantage of that tax advantage. So something else very important. Many people will defer Part B, but not defer Part A because there's no monthly premium, so why wouldn't you? Well, you do want to defer Part A if you need to continue to actively contribute to your HSA. Because if you have Part A, you can't contribute to your HSA anymore. So make sure that you go ahead and defer Part A as well. And of course, you can't be collecting Social Security benefits if you want to continue to contribute to your HSA. Finally, let's talk about Medigap. As I mentioned earlier in the video, there's no specific enrollment period for Medigap, unlike the other parts of Medicare. And unfortunately, this can lead many people to just forget about Medigap, which can be an extremely costly mistake. You see, although there is no specific enrollment window, there is sort of this golden window, this 6-month window after you turn 65 and enroll in Part B. During this initial 6-month window, you will not be subject to medical underwriting, which means you cannot be charged more and you cannot be denied. You'll basically have your pick of the Medicare supplement plans. If you choose to enroll outside of this 6-month window, then you may be subject to medical underwriting, which means you could be charged more or denied outright. This is another benefit to deferring Part B. So even though you've turned 65, that 6-month window doesn't begin until you re-enroll in Part B. So here are some key takeaways. If you or your spouse are still working and maintaining creditable coverage, then you can choose to defer Part B and of course Part D as well. However, if your employer has less than 20 employees, then Medicare will become your primary, so do not delay. And of course, if you are self-employed and do not have group health insurance, then it's very important that you enroll on time to avoid those late penalties. But remember, make sure to take into consideration your dependents and your spouse if you provide health insurance to them. And of course, make sure to make an appropriate decision regarding contributing to your HSA. If you do choose to defer Medicare, make sure to follow the instructions on the back of the card and send it back, because if you keep the card, you keep Part B and you will be charged for it. If you have questions, you can reach us in the comments below or at the number on the screen. We are of course licensed nationwide and we're happy to help answer any and all Medicare related questions. Please make sure to like this video and subscribe to stay up to date. And if you want to learn more about Medicare, I highly recommend this video over here or this All About Medicare playlist. We'll see you next time.